Good day, I'm Dr. Eloise Wessels, a general practitioner at Intercare Silver Lakes. Today we're going to talk a little bit about cardiovascular disease. This is the diseases that affects the blood vessels in the body, and the two main complications is heart attack and stroke. But today I'm mainly going to focus on prevention of cardiovascular disease. According to the South African Heart and Stroke Foundation, cardiovascular disease is the second largest killer in South Africa. Globally, it kills more people than HIV, TB and malaria combined. To put it a little bit more into perspective, every hour 5 people in South Africa will get a heart attack and 10 people will get a stroke. Of those, 10 people will actually die. So as you can see, it is a big problem in our country. The American Heart Association has compiled a list of things that you can do to prevent heart disease in the different ages. Starting in your 20s and 30s, it's never too early to start looking after your heart. So make an appointment with your general practitioner and let them have a look at all your risk factors. Also, it's important to remember to tell them what is your family history. If there is any heart disease or high blood pressure or sugar in your family, so that we can know this and especially look out for it. Then also don't smoke, and if you started smoking, stop smoking. As you get older, your metabolism starts to decrease, so it's more important to focus on your diet and exercising during this time so that you make sure that you don't gain any weight. It is also especially important during this time to get your blood sugar tested, as your blood sugar tends to rise during this stage, and diabetes is a very big risk factor for cardiovascular disease. Also, if your partner tells you that you're snoring, don't ignore it. Tell your doctor about it so that they can do the necessary tests and make sure that you don't have any other risk factors for the cardiovascular disease. And then, if you have been diagnosed with any of the risk factors for cardiovascular disease, like hypertension, diabetes, or high cholesterol, make sure that you follow your treatment plan. That includes the lifestyle changes that your doctor recommended. As you get older, your risk factors for getting cardiovascular disease increases. Your blood pressure tends to rise, your cholesterol tends to rise, and you can develop diabetes. So it is still important to follow up with your GP regularly. It is also important at this stage to maintain a healthy lifestyle so that you don't gain the excess weight that will increase your heart's workload so that you can develop cardiovascular disease. It is very important to get to know what the early signs are for a heart attack and a stroke, so that if you develop any of those signs, that you can call for help immediately so that you can prevent the damage caused by these diseases. So it is important to know that it is never too early or too late to start looking after your health and to visit your general practitioner regularly. Intercare has a number of branches across South Africa that has general practitioners that can help you look after your heart. And remember, it's never too early or too late to know what a heart attack or a stroke sign might be.